This virus is pro-inflammatory, pro-thrombotic, and pro-immunogenic. When it's pro-inflammatory means there are some inflammatory markers. And these markers are like CRP, a C-reactive protein. If C-reactive protein normally should be less than 6, but if it's 20 to 40, it's mild, 40 to 60 is moderate, more than 60 it's severe. So you have to see in which category you fall. And please consult your doctor who knows about the subject well. And number 2, we take interleukin 6, which is a very important inflammatory marker. The normal level is less than 7. If the rise is more than 3-fold, it's mild. If the rise is more than 6-fold, it's moderate. And if the mild is more than 8-fold, it's a severe. Similarly, ferritin levels, and we also do other LDH. They also give you some information about the inflammation. So these are all the inflammatory markers. Then we have a clotting marker, which is a D-dimer. D-dimer is a very, very powerful and sensitive marker, usually less than 0.5. If the rise is more than 3-fold or 5-fold, we say mild. If the rise is more than 10-fold, it's a moderate. If the rise is more than 15-fold, it's a severe type of COVID. So based on the clotting or coagulation markers, inflammatory markers, and clinical markers, we label as mild, moderate, and severe. The third, which is very important, is CT scan. HR CT scan, high resolution CT scan. There was some controversy a few days ago, X-ray versus CT scan. I must tell you, ladies and gentlemen, today, HR CT chest is a very, very sensitive and specific for diagnosis of COVID-infected pneumonitis. Number of times we may miss by X-ray. And the radiation exposure is not much. It's a myth that the radiation exposure is 400 times. No, it's not true. It is equal to 4 or 5 X-rays. Even if you do 2 or 3 times in the whole protocol of the treatment, it's safe, very safe. So according to me, the best imaging technique is HRCT chest. By HRCT chest, we divide the lung segments into both sides into 25. And if the involvement is less than 9, we call it as a mild COVID. If it is 9 to 14, we call it as a moderate COVID. And if it is more than 14, it's a serious COVID. But if it's 24 by 25 or 25 by 25, then it's a critical COVID. So how much is the information? But people are not subjected to CT scan. And then they come to us in the post-COVID period as sudden death. Nobody knows them, what has happened. As I mentioned to you, that it is this virus which is peculiar. It causes heart attack, lung attack, brain attack, leg attack, and abdominal attack. There's a very nice expression by one of the Italian studies. It says that the COVID virus is one which hijacks the body right from head to the toe. Please try to understand the importance of investigations. They are very important. Our aim is to reduce the inflammation of all the blood vessels, reduce the inflammation of the heart, what we call the myocardium, to prevent the myocardial injury, to prevent the clotting in the heart, what we call as a heart attack, to reduce the inflammation of the lungs, which is produced by cytokine storm, and to reduce the clotting in the lungs, which is a fatal complication, what we call as a pulmonary embolism. And similarly, to reduce the clotting in the leg veins, which is known as a deep vein thrombosis, or it may also help to reduce the clotting in the brain. This morning I had a call from Chennai, and the call was the patient had COVID 4 days ago and was taking some treatment at home, and then the patient had a stroke. Why stroke? Because no anticoagulants were given. It's very pathetic, very painful in the patient diabetic and hypertensive and elderly patient. So we have to understand when to give anti-clotting drugs, when to give anti-inflammatory drugs. I'm sure Vishali very shortly will discuss about the treatment part, but we have to make sure that the inflammation should be taken care of, clotting should be taken care of, and the injury which is produced by the virus should be taken care of right from head to the toe. This is what I wanted to say about the diagnosis as well as our approach to the patient. Please, a very important message for everyone. First 7 days, the natural course of disease is subtle, is simple, but don't take it easy after 7 days. Subject all our patients to HRCT chest after 7 days to assess the CT score. And based on the severity, take a decision which patient to be hospitalized and which patient can be managed at home. Here I give you important message. Anybody who is HRCT chest score in less than 9 can be easily managed at home. But if anybody's score is more than 10, please hospitalize. If anybody's saturation is less than 85 or 80, please hospitalize. If anybody has a significant rise of CRP levels and D dimers, please hospitalize. So timely hospitalization and timely home isolation is a need of the hour. You should not worry in the home isolation. Who will give me food? Very simple. You can keep a stool outside your room. Somebody can serve food. You can pick up your food and you can leave it there. How will you take bath? Take a light sponge bath. Don't be very aggressive. Don't exert much. But please be mobile. Keep on walking. Take immunoboosters. Have a good diet, good rest. But don't be in anxiety. That's a very important message in home isolation as well as in the hospital admissions.